What is flu? Flu's quite an often overused word in the English language. Flu in medical terms is a specific illness where you contract the influenza virus. This is usually much more severe than even a heavy cold, and most people will be consigned to bed for a few days. People who are in at-risk groups, such as people with long-term medical conditions, can suffer quite severely and may even end up hospitalised. Flu can't be treated with antibiotics. There isn't an awful lot of medicines that can specifically treat it, so often the treatment is what we call supportive. So patients have to recover from the illness. If they end up in hospital, they sometimes need IV fluids, but often the best treatment is to prevent getting it in the first place. The best way of preventing flu is to use common measures to stop the transmission of infections such as hand washing, but also have the flu vaccine, particularly if you're in an at-risk group.
The jab has various benefits. Obviously it helps prevent you catching flu. It gives you that additional protection, and I think there are lots of patients who are very vulnerable to catching flu. Flu is a virus and itself doesn't create too many problems if you're fit and healthy. Unfortunately, if you are a vulnerable person, such as someone over the age of 65, those with what we call long-term conditions, that includes patients with asthma, diabetes, COPD, heart disease, those who've had stroke, those with neurological conditions, as well as those taking medications that might suppress their immune system. If they catch flu, flu can be quite dangerous. Now, we've been giving flu jabs for a very long time, and it is perfectly safe. Although when you have the flu jab, you can sometimes feel a bit unwell, and that's purely because when you have the injection, it just causes a bit of irritation, make your arm a bit sore, and you might have a bit of a sniffle or something, but that's quite common and it's quite normal.